All right. Good morning, Carol Johnson.
And a good morning to you, Bob Bonte.
It looks like a nice day. The sun is actually out after several days of clouds. It looks like it's going to be nice outside.
Clouds and rain, and coldness. It got cold really quick.
Yeah. Yep.
Which that's what happens in May. You get
Well,
May and
kind of
June.
it kept people from losing their minds this weekend, because everybody was ready to just go out there and just it's
Bob, I
like
don't know.
not yet. Not yet.
Everything's everything's out of control over here. The
Mhm.
shootings, the shootings, the shootings
Mhm.
are really out of control in this neighborhood every night.
Wow. Mhm. Shame. So what we want to talk about this morning?
Well, there's several things that's happening now.
Mhm.
One thing, senior centers are starting to open again. The seniors were really getting antsy,
Mhm.
and I don't blame them.
Mhm.
But anyway, they're opening now. All of them can open to do outdoor activities.
Mhm. Mhm.
Uh, but indoor activities will resume. They can all open, still socially distancing, but they can
Mhm.
all open on June 14th.
Mhm.
So, we suggest that you call your senior center and see if they're up and if they're doing things. Some of them have outdoor areas and they're out there doing exercises, and some of them are having lunch. Distributing lunch. Most of the senior centers again are distributing grab and go lunches.
Mhm.
So call your center, and if your center isn't part of it, just call the center closest to you,
Mhm.
and see if they're distributing meals and what type of activities are going on there. And then on the 14th, they'll be open to, not full capacity, but they will open.
Mhm.
So that's pretty exciting for us seniors. You know, and from what we understand, kids who have been vaccinated and non-vaccinated kids can go back to camp.
Right. But they're saying that vaccinated kids can go maskless.
Maskless.
We would not recommend non-vaccinated kids go maskless at this point.
And that's going to be up to the parents and up to the staffing
Mhm.
to make sure, because you sure can't take a 12-year-old's word for it that they had vaccination. So that's going to be up to the parents, that they're going to have to do their homework and make sure that they have the stuff documented,
Mhm.
and how those activities are going to take place. So again, parents, you need to contact the camps, either day camps or the sleepaway camps that your kids go to, and find out what's going on with that.
Mhm. So we were looking at some information from the Journal of the American Medical Association, JAMA, which is one of the top uh, medical journals. And they've been looking at people who had COVID, and they're seeing that 73% of them had at least one long-term persistent symptom. And most frequently, those included shortness of breath, fatigue or exhaustion, sleep disorders, or insomnia. And so that's just a reminder why, we say, you still want to do all the things you want to do to protect yourself. Um, it certainly looks like we're in the downswing. Looking at the numbers here in New York City, they have gone way, way down. They're under 1% in terms of infection rates, which is good. But we also caution people to remember that we're still an international city, and as the tourism comes back, COVID can come back from any different place. And the biggest threat right now with COVID is the variants, the different strains that are out there. And Matter of fact, they're renaming the strains. That was also another story this week. That instead of calling them the uh, the India strain or the Brazil strain or the UK strain, they're now giving them Greek names like Alpha and Delta. And I think that was basically to get away from this thing where some
Stigma.
country starts taking the blame for a virus mutation, like it's India's fault or Brazil's fault, that's where the virus mutated, which just doesn't make any sense.
Right.
And it even goes back to the original issue of trying to call it the China virus. you know um Virus is the virus. It doesn't matter where it starts if it's here now, and if it mutates, we just need to know something to call it. And the other thing that we figured out, one of the few things that we know for sure in this pandemic, is that the scientists who study this thing have no clue on how to name things.
It's, I mean, you're right.
They're bad on the names. Bad
You,
on the names.
you know,
'Cause
you're
First,
absolutely right.
first
It's
it was COVID-19, and then it was SARS-CoV-2, and then there's like, well, no, the disease is COVID-19, but the virus is SARS-CoV-2, and it's like, y'all need to get on the same page.
right. I mean, yeah, I can speak from experience. When you have a name, you feel
Right,
so much better. But in this particular case, you don't need, just say COVID.
right, right.
Keep it simple. We saw what happened with the stigmas attached behind the Chinese virus and all of this.
Mm-hmm,
How people were being attacked.
mm-hmm.
And it wasn't even Chinese people that was being attacked. That's the sad thing about it. It was Koreans. It was anybody Asian,
Right,
were
mm-hmm,
being attacked. And people was like, I'm not even Chinese. What are you
right,
talking about?
mm-hmm.
It doesn't matter. You're all the
Yeah,
same. So a lot of things happen behind that. We got to be really careful with
mm-hmm,
what we say and what we do. But the bottom line is people are still sick. Uh, I know quite a few people that did survive it. But it's funny. One was very, very, very healthy.
mm-hmm,
Ever complained, and now it's like every time I talk to them, they're going back to the doctor. What's going on now? Man, my back hurts. I can't bend over. I can't lift my arm. My left arm, you know, hurts so much I can't use it. My neck hurts. It's something.
mm-hmm,
It's like it's muscular,
mm-hmm,
but they're back and forth, and they're like, I can't stand up.
mm-hmm,
They had to get a chair. They're working on trying to get a walk or something just to help them get up out
mm-hmm,
of the chair.
mm-hmm.
This is somebody in their early 40s
Wow.
who's very, very active, and now they can barely move. Every time they wake up, there's something going on, either added on to what was happening the day before,
Mm-hmm,
or something is persistently just like getting worse.
mm-hmm.
So again, we won't stop rallying the cry. Don't make the call. Even with the vaccine, you don't want to get this because there are no findings in terms of people who have gotten the vaccine, who have still gotten infected in COVID. What's happening with them?
Right, right. There's in fact there's some. So the term they use for people who have gotten vaccine and still get infected, they call that a breakthrough infection. That's the other thing. What they are good at is coming up with nice names for things that you really don't want.
Right,
so, so a breakthrough infection sounds like fun. Oh, I'm breaking
right.
through. No,
How should
no,
I dress?
that's not. That's not fun at all. Uh,
No.
so the numbers on breakthrough infections have been small so far. So there've been like 101 million um, people who've been fully vaccinated, and they've had 10,000 breakthrough infections, which is about 0.01% of it. However, recently the CDC has decided to um, now start only monitoring serious breakthrough infections, meaning if it gets to the point where you're hospitalized, they're tracking that, but they're not tracking everything. And there are some doctors who disagree with this. We saw an article on Med Page where somebody felt like this was something that we should use all the data at this point in time because this is still something where we're still trying to learn as much about it as possible. And the other thing about the breakthrough infections is that it's happening most in the variants, and this is where it gets kind of where we really have to stay vigilant because the variants are spreading faster than the original version of SARS-CoV-2 that came over here. And if the variants are where the breakthrough infection is coming, that's where we need to kind of pay attention to what happens because we know that the original formulations of these vaccines were based on the original virus. And we know that they are looking at creating booster shots where they're probably going to do some sort of a tweaking on it to make it more resistant to the variants. But that doesn't help you right now if you've gotten fully vaccinated for the original one and a variant comes. So we have to keep our eye on the ball and not just jump out and say that we've you know that everything is hunky dory at this point in time. So, we continue to advise people to be cautious. I'm optimistic in terms of the way the numbers are going, but we still want to look at these things. We still want to make sure that the numbers make sense in terms of what all the people in the medical community are saying. We want it to be verified with what doctors who are on the front lines are saying, what doctors who are caring for people with long haul symptoms are saying, and just exercise common sense, which
Yeah,
is
so
something.
that's been the problem. I think that's what made the numbers go up so rapidly.
Hmm.
Why it just got so totally out of hand. It's never enough information. The
Hmm.
information has been like piecemeal.
Hmm.
A little bit of this, a little bit of that. We don't need to know. We don't need to know that. If this is something that's different and is new, even though coronavirus may have been around for a long time, but this is like a variant of a variant.
Right.
So every single aspect of this disease should be monitored.
Hmm.
Nothing should be overlooked. And
Right.
it's almost as if, the powers that be want to say, yeah, well, these people are long haulers. Okay, well, let them deal with it. We spoke about this last week. The doctors have no idea what they're dealing with.
Hmm.
So this is why this information needs to get out to the medical community, why they need to have some type of data bank where these doctors can document
Hmm.
the ailments that these people are suffering from.
Hmm.
How they're treating, get some help on how they can get this thing under control, whatever it is.
Hmm.
And there's just this continual disconnect. you know let's just get the numbers down, and once we get the numbers down, forget about everything else. Forget about all the people. You got 150 moratoriums that's starting up again. Section 8 is opening up again.
Hmm.
Sisters is opening up again. You've got a lot of things, but you got a lot of people who were pretty much healthy who
Hmm.
now feel like, I just want to die. I survived the virus, but I just want to die. What I'm
Hmm.
going through now, and there's no help for them.
Hmm.
And I still think it's up to the governor and the mayor, while you're counting the numbers that's going down, you need to count the numbers of people who are still suffering
Hmm. Hmm.
and not just forget them and just keep it moving and open up the city.
Right. Mm-hmm.
So there's just too many conversations that are either not being had or they're being had undercover. But in the
Mm-hmm.
meanwhile, the people are still suffering. The doctors don't know; they're not getting the information.
Right.
So that's not helping the sufferers.
Mm-hmm. Mm-hmm. Yep. So there are several doctors who are really feeling that they should be, taking every aspect of information that they can come in and really monitor this stuff. So we'll continue to keep our eyes open. We read all the medical journals and all the reports that we can to keep track of what's going on.
Yeah, that's the best we can do. We try to give you information as it comes. Um, it's vetted, and you can always still go back to the websites, go back to our YouTube channel where this programming is saved, and look back and look up these articles and see what's going on. Just don't stop doing your homework.
Right, 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 right. Matter of fact, I'm going to show an article that we're looking at here, which just gives us the reason why we pay attention to this stuff, which is talking about conflicts of interest that some of the vaccine advisors have. So this article here in MedPage, are vaccine advisors more conflicted than we thought? And the article starts, when it comes to authorizing COVID-19 vaccine, members of FDA's advisory committee and the UK's counterpart often have undisclosed conflicts of interest. Panelists for these advisory committees are only required to share conflicts of interest from the last 12 months. And when they do disclose these relationships, the committees do not always consider them significant enough to disclose to the public. But some of these people have patents. Some of these people have other relationships with the vaccine manufacturers where they are making different types of fees. So, it just, you know, we just want to remind people that, you know, we not only have to look at the data, we have to look at where the data comes from, and we have to look at all the people involved because, quite frankly, there's just a lot of money that's being redistributed around this pandemic. And, when money follows, the rules sometimes get bent a little bit. And so, we say trust the science, but you have to also not only trust the science, you got to trust the scientists, so we got to look at both of them, to understand where we are in this thing.
Absolutely. It's just a matter of just paying attention. There's been a lot of information. I know it could be overwhelming, but you just take that information and you take the basic portions that will ensure your safety to the best of your ability.
Mm-hmm.
You don't have to get bogged down. We're giving you information because it's out there for those that want it, want to invest in it and dig deeper. But for the most part, it's about safety.
Mm-hmm.
Maintaining the safety of ourselves first and our families.
Mm-hmm.
And so that's all you can grasp from this. That's wonderful because that's the key. That's the key. There's always going to be fighting. Big pharma exists all over the world. It's always going to be a money's game. You know, um, but you don't get caught up in that. This is just information.
Mm-hmm.
So we have a lot of uh, families that are mixed. You have people that's of East Indian descent. You have people who are Italian, different things like that. There's different things happening in different people countries. They
Mm-hmm.
may be getting information from one source, and we may be getting information from other sources. But at the same time, it's not it's not cohesive, and
Mm-hmm.
so it's just information that's being given out. But we don't get bogged down by stuff. But what it does is that when we see these different things coming out, it kind of takes you right back to home. It helps what's happening right here in the United States make sense. And
Right.
people have been trying to make sense out of nonsense, because a lot of this has been nonsense that
Mm-hmm.
has been happening or not happening. And
Mm-hmm.
the overlooking of a lot of major facts is what helped this thing to balloon.
Mm-hmm.
The overlooking of certain people in certain communities caused this thing to balloon. And of
Mm-hmm.
course, you don't let the people that, when you do start slowly opening up the city, all those people with the underlying illnesses and all those people who would be the ones that would be in the face of other people, those
Mm-hmm.
were the ones that was not getting to the hospitals. Those were the ones that was not able to get the vaccines. Those
Mm-hmm.
were the ones that was most vulnerable, which put the other parts of the population at risk.
Mm-hmm.
Because these are the people bringing the food to your house.
Mm-hmm.
They're going back to households with people who was told not to go to the hospital when they had COVID. These were people that had, um, you know, non-symptomatic COVID, and they're going about their business, and they're working in the bodegas, and they're like right in the face of the general population, which just made everything just go awry.
Mm-hmm.
When you looked at later on, remember we had the vaccine buses for all the the workers and stuff like that. It's like, you should have done that first.
Mm-hmm.
If you knew that these people were driving Ubers, and not only, we're not just talking about people who was ordering meals, who had food to call their favorite restaurant and order a meal.
Mm-hmm.
We're talking about the Get Food program that was bringing the food to the seniors, the people that were bringing the medication, the messengers who was bringing, medication from the pharmacies. We're talking about these type of people who were coming to people's houses. You had the people in the house, the vulnerable people who didn't have masks. You know, they didn't even know. Well, just take anything and tie it around your face before you open the door. I mean, there was so many things that we look at. We're like, between Harlem Emergency Network and East Harlem Co-ed, we're like groups that we have our own little think tanks.
Mm-hmm.
And so we were able to sit back and say, okay, what would you do? What makes more sense? How do you quarantine people in a household? Nobody on the outside was telling us. None of the health professionals was telling us. So we kind of just sat back and used
Common
some good
sense.
common sense. That's not always common today.
Not a common at all.
And it
It's
worked, you
yep.
know.
Mm-hmm.
So those were the people that you would think, but you figure, how long after the vaccine was discovered? 5 months later, you decide to start to vaccinate that segment of people. It was insane.
Mm-hmm.
So we knew we were like on a limb out there, on your own. On your own, waving a little white flag and not telling you to focus on if somebody was coming. We practice the yo-yo theory. You're on
On your
your
own.
own. And
Absolutely.
that's what we kept pushing.
So I want to talk about one more story that we saw last week that relates to the overall response to this pandemic, and we saw how systemic racism, in our medical system led to very poor outcomes for Black and Brown people. So there is a company called the Lone Institute Hospitals Index, and they've done the first ranking to examine the racial inclusivity of over 3,200 U.S. hospitals to assess their success at serving people of color living in their communities. And so they rank the top 50 the best, and they rank the bottom 50 the worst. So some of these hospitals are in our area, so I want to give out some flowers and also some rotten tomatoes. So the number one hospital in the country for racially inclusiveness is Metropolitan Hospital right here, number one. And out of the top 50, also in the top 50, number 8 is Harlem Hospital. So we're actually very blessed to have in our area two hospitals that show racial inclusiveness. Also, Lincoln Medical and Mental Health Center is on this list. Uh, Queens Hospital Center is on the list of top 50. Um, in New Jersey, Trinitas Regional Medical Center, Upstate Erie County Medical Center, Palisades Medical Center, and Kingsbrook Jewish Medical Center. These are all in the top 50. Kingsbrook Jewish is number 50, but they made that list. So we give them flowers for, you know, basically, being racially inclusive in terms of how they are handling the communities that they're in. Now we want to also look at the bottom 50 because we saw some local candidates in there too. So let's take a look at this list. So these are the worst in terms of racial inclusiveness. So what do we see in New York? Lenox Hill Hospital. Surprise, surprise, no surprise. Um, New York University Langone Medical Center. Northwell Hospital Glen Cove out on Long Island. Stony Brook University Hospital. Westchester Medical Center. So unfortunately, we have more New York hospitals. North Shore University Hospital. We have more New York hospitals. St. Francis Hospital, the Heart Center. We have more New York hospitals on the bottom 50 than we do on the top 50, which is surprising and disappointing.
And isn't it interesting that if you're not on the list, that means that you're 50 plus, which makes you either worse or still one of the ones that's better
Hmm.
than the worst. Where's Mount Sinai?
I didn't see Mount Sinai at all, which we
Right.
talked about that because, um, you know, we know that Mount Sinai has had problems. And so it's very interesting that they were not on that particular list. It might have been the criteria that they use, but the thing that has come out of COVID is that we have to look at all of the institutions that are touching our health, and that includes the hospitals, that includes our various departments of health, that includes our federal agencies, and all of them we need to have an accounting for how did they perform during this pandemic because nobody really gets an A. Let's just start from there. We're not giving out any A's for anybody on pandemic performance.
It's funny because I mentioned them because they're such a large institution. They've taken over almost basically every hospital from St. Luke to uh, Beth Israel and Roosevelt Hospital, and now they've got centers all over
Hmm.
because each one of those institutions had so many, neighborhood clinics that
Hmm.
came out of the hospital. So now that Mount Sinai took them over, they've got all of that too.
Hmm.
And that's where the majority of the people here I know in East Harlem weren't going to Mount Sinai because they were told to stay home
Hmm.
and not go in. So That was what we were calling the petri dish,
Mm-hmm.
for COVID. Metropolitan Hospital had managed to keep their numbers very, very low because they had an emergency. I had to give it to my Metropolitan. Metropolitan has an emergency team that is really, really on point.
Mm-hmm.
I have to give them their props. John
Mm-hmm.
Castillo, all through um, this time that I've been dealing with emergency preparation and going to their drills and tabletops, and you just watched how they stayed in a preparatory mode, constantly checking to see who's on board, what they have, what beds they had available. And this was an ongoing thing that they did throughout the years, in preparation. That's what we do, prepare the mitigation.
Mm-hmm.
And so they were able to respond effectively. And it's ironic that even when we had Hurricane Sandy,
Mm-hmm.
that was the hospital that actually responded the most effectively of Mount Sinai, Lenox Hill, Langone, all of those hospitals that's on the eastern seaboard, right there on the East River, who
Mm-hmm.
didn't know what to do, sent everybody up to Metropolitan. Metropolitan's like, well, what are you sending people here for? We're just across the street from you. So if the water, if your buildings are not waterlogged, ours is too. But they took control of it and
Mm-hmm.
forced Mount Sinai to take those people, to
Mm-hmm.
take those patients in. So I have to say that they've always been on top. They were the first hospital that opened up to give the vaccines, the testings. The other thing is that they had limited testing because that's what they were provided with.
Mm-hmm.
They couldn't just order 1,000 tests. This is what the city was providing them with. And
Mm-hmm.
now COVID testing, and vaccinations are free there. So I gotta give kudos to that emergency preparation staff, that whole group who have stayed so vigilant over the years. And when push came to shove, you saw that they were ready because they practiced, practiced, practiced. And when it came time to answer the call, they were on point.
Mm-hmm. So, my final words before we close out this live stream is, we have the same advice that we talked about in March of 2020 that we're talking about in June of 2021, and that is, um, learn how to boost your immune system, because your best defense against all this stuff is a strong immune system. Remember, the vaccine doesn't kill the virus. The vaccine alerts your immune system so that your immune system can kill the virus. And in terms of recovering from it, if you've had it and you're recovering, you still need to boost your immune system. So you want to do the things that can reduce inflammation in your body. And we talked about the things we talked about in March of 2020 have now been verified by doctor after doctor after doctor. We told you about vitamin C and vitamin D. We talked to you about zinc. We came on later on and talked to you about melatonin. We talked to you about getting enough sleep. All these things are still critically important. And the lifestyle choices you make, there is no, we have to get out of the mentality that there's just one prick solution for your health problems. Um, you know, every one of these vaccine manufacturers will tell you there's no guarantee on it. Um, and so the guarantee that you have is doing all the other things as well as that. You know, whether you get the vaccine, whether you don't get the vaccine, you must take care of your body. You must learn how it works a lot better, and you must do the right things. We already know what all the lifestyle things we should not be doing. You should be laying off the sugar. You should be laying off, heavy consumption of meats. We know these things, but it used to be that they would kill you slowly. Now they're killing you quicker, and so we all have to make better health choices. You know, and that's all we got to say for today. It's a beautiful day. Continue to use protocols. Enjoy yourself. Get some of the sun. Remember, the sun is direct vitamin D. It's literally like getting medicine from God. So, um, take it and enjoy it. So we will see you. Carol, you there? All right, well, we are done for this broadcast. We will see you next week, same time, 9:30 a.m. with the latest and the greatest. And take care of yourselves.